Okay. Okay, so I'm gonna share my screen first. There's lots of screens up here, but this first one, so my stuff's gonna look really different because I have access to every single campus class, okay? And I've been teaching, and so I have tons of stuff. So if you have it published, there's something called Columbus Dean's Corner, and it would be here. If you don't, this is a link. This all courses is a link. And people think that that's just courses that are listed. You can actually click on that and you can access every single course that you have ever taken in any of the programs. So if you did the MA, if you did RN, anything like that, you can get into any one of those classes. Okay. So this one's going to be crazy overwhelming because I have a ridiculous amount of classes on here. Yours won't look like this, but you can get into all of these. So if you do this, you see how you can see everything. Obviously, yours looks different. You're going to have something that is called Columbus Dean's Corner on it, okay? When you click on that, and your home screen might be look different too, there is academic coaching. It's the first module. I'll put myself on the top. So it's the first module. There's also coping with stress and anxiety. I wrote this. So in the new course shells and modules, there's like a coping with stress and anxiety that National is publishing that they asked me to write. So this is also in that. You also have our SNA is on there, and then tons of clinical stuff. See all of this clinical stuff, Castle Branch, all kinds of stuff. There's tons of stuff on here, okay? If you go into my coaching one and it says YouTube channel coaching center, you just follow this link.
There it is.
Okay. So it'll take you to, there's only one video on there. It's the HESI prep one because I'm not very tech savvy and it's a work in progress. But I will, once this converts, I'll post this on there too, and then the workshop from the next one. And then the idea is kind of like Dr. Molly used to do with all of the different review videos and stuff, right? So then this will house a bunch of different videos and stuff. But that the HESI prep one is already on there. Okay.
Okay.
All right, so I'm going to stop sharing for a second because sometimes it won't work if I click between the two. But here is your bow tie. Okay. So when you are approaching this, I like these because they're kind of like case studies and you literally cannot add to the question. Okay. So many people try to add to the question and it's classic. I did it too. This really doesn't allow you to do that. So what you're doing is you're going to go through this whole patient history here, right? It's going to give you exactly what you need to answer the question, exactly what you need. Where students run into trouble is they start here because we read left to right, right? So what happens is students start here and then they go here and they go here. The problem with that is if you start here on these actions to take, and you choose these actions, you can talk yourself into any one of these conditions, okay, based on your actions. So what happens is people typically they might get this correct, but then this one over here they're going to get wrong, and then you go into the parameters to monitor. So here's what I want you to do is I want you to read, and this is a pretty high level case study, but you're going to read through this patient history, okay? Once you read through this patient history, then you go straight down to the center, okay? And you're going to say, based on these signs and symptoms that I'm seeing, based on this patient history, based on my assessment, whatever it is, what do I think is going on with the patient? I want to choose one condition, just one. What is the potential condition? What do I think is going on? So let me see. This is an ICU patient, but let me see what it is. Racing heartbeat, feeling faint. Okay, so I'm going to tell you that this one is going to be, it sounds like AFib. Vital signs are 142, history of coronary artery disease, hyperlipidemia. Yeah, it's probably AFib. So what you're going to go down and do is you're going to choose one of these conditions. Okay, so just to give you an example, if you go down to the left and you say, okay, well, I want to monitor airflow with incentive spirometry and I want to do a stress test, okay? You could potentially talk yourself into pneumonia. That's not what's going on. That's why you want to go down to the center. So when you figure out what's going on and you say, okay, I think it's AFib, right? It's atrial fibrillation. Then you want to go over to the left, okay? So your approach here in this, I'm going to see if I can get into the chat. Yes, your approach here in this is number one, you want to go into the center and choose your condition, okay? Number two, you're going to go over to the left side. And what you're doing here is you are choosing your actions. So based on this AFib, if you think your patient is an AFib, what are you going to do? Well, first of all, we're going to get an EKG because I want to see if my patient is actually an AFib, right? Versus VTAC or having a heart attack or whatever the case may be, okay? And then I'm going to tell you, we're probably going to give them some meds because this looks like AFib RVR to me. It could be, okay? But it just kind of depends. And that doesn't, I don't want to go into that because the point is you approach everything the same. You are always only ever going to choose two actions. Every single bow tie is exactly the same. One condition, two actions, two parameters to monitor. That is it. So you know that only two of these are going to be correct, okay? So you choose your actions. Then what you're going to do is you're going to flip all the way over to that right side. So now your third thing is right side, choose what to monitor. Your parameters to monitor are what you're monitoring. Choose what to monitor, okay? So if you went with AFib and you've chosen a couple of things, then you're going to go over here. Your parameters to monitor is how do you know your patient is getting better, okay? So what is going on with your patient, potential conditions? How are you going to fix it? And how do you know what you did worked, okay? So what do you want to do? You want to come over here and you want to see what's going on, okay? I don't know about you, but I'd probably monitor that heart rate, right? Because I want to see if that heart rate's coming down. We don't like a heart rate, what it was at 142. We don't like a heart rate of 142 anyway, okay? But especially if somebody is in AFib, what are they going to do? They're going to throw clots and they're beating too fast, right? So we want to slow that heart rate down, okay? If we slow that heart rate down, what else can happen? Those pulses, right? So maybe I'm going to monitor some pulses, okay? I don't need trope levels, troponins for a cardiac event. If this patient is having a heart attack, but you don't have that option in the center, if this patient's having a heart attack, then I'm still going to get an EKG. I might do something else. I'm going to come over here. I want to watch that trope level. I still want to watch that heart rate, okay? So if you take that approach, I guarantee you it's still not gonna be easy. You haven't been a nurse for 14 years, okay? But it is gonna be so much easier if you take that approach because you go in and you choose this condition and you go, oh, okay, great. Here's what these conditions are. Now, how do I fix it? And how do I know that I fixed it? If you start over here, you can talk yourself into any one of these and the whole thing is gonna be wrong, okay? Devonna, does that help? Is that kind of what you
It does, but
asking
it's kind of
about?
like what Jeffrey was saying. Like, I feel like some of the options are kind of similar, so it's like hard to pick which exactly like it should be. Like, you're saying it's AFib, but I'm looking at like ventricular tachycardia.
Yeah, but
Like,
that's
you don't know
because you don't know the
exactly.
difference between AFib and VTAC yet, sweetheart.
Right. That's what I'm just saying.
Yeah.
Like, it'll be
So
similar like that, and you're
if
like,
your
well, I don't know which
patient's
one.
in VTAC, you're not getting a heart rate. Like you're not, if
Um,
your patient is in VTAC, this is giving you a heart rate of 142, okay?
mm,
VTAC is crazy. VTAC is a lethal rhythm. We do not like VTAC, okay? And what's happening is those ventricles are firing like crazy and you're not going to be able to get a heart rate. And that's why I know that it's not VTAC, okay? It's a little bit different. So, and as far as an aneurysm, he's got a racing heartbeat and feeling faint. When people have AFib, what is happening is because it's fibrillating, so it causes that racing heartbeat, and they're not oxygenating well, and they'll tell you it feels like my heart's skipping a beat. Okay, in VTAC, probably not talking to you too much. Okay. There's actually a
mhm,
pulseless VTAC and they're definitely not talking. Okay. VTAC's a problem. Okay. VTAC is a lethal rhythm. And so we're doing other things. We're putting the pads on, we're doing all kinds of other crazy stuff. And
mm,
that's why I didn't want to dig too much into this because this is at a level that you guys, you're not there yet, right? Because you haven't come to me and we barely even do rhythms at the tail end of med surge. So if I gave you something and I gave you this history and I said, okay, what are your potential conditions? And I said, now pneumonia you could do. What if I said pneumonia versus COVID versus, let's keep VTAC in there, versus, I don't know, a heart attack, right? And you're trying to decide between the two, COVID and pneumonia are going to look similar, but you might see some different lab work or patient history, right? Pneumonia, you can get pneumonia acutely, but what does that result from? It results from immobility, it results from atelectasis, it results from a secondary infection, right? If I
Mm-hmm.
tell you your patient is, I don't know, 30 years old, active, runs marathons. Now they have a cough, they have an O2 saturation of 88%, and they feel short of breath. Well, that's not going to be pneumonia, it's going to be COVID, right? So then you go into this COVID. Well, now what are you going to do about it? Well, I probably want to check, you know, maybe some lung sounds, right? Because what, my actions, right? You have some lung sounds, and let's say your lung sounds, you're gunky in your lungs. What are you going to do? Well, what am I going to do? I'm going to give a breathing treatment. I'm going to use the incentive spirometer. I'm going to teach my patient, I don't know, whatever other number of things for COVID. I'm going to push fluids. Okay. I'm going to push fluids because I want to thin those secretions out. Okay.
Mm-hmm.
Then, number three, you're going to come to the parameters to monitor. So if your patient has COVID and we're trying to fix their breathing because their O2 sat's not great, what are you monitoring? O2 sat, right? How do we know your patient's getting better? Because that O2 sat comes out of the 80s and it starts to rise up. Your patient says, oh, it's easier to breathe. I don't feel short of breath anymore. And so you're monitoring. What you are doing here is you are looking for improvement, okay?
Mm-hmm.
Could the breathing get worse? Yeah. But then we need to go back and we need to change these interventions. But if the breathing is getting better, then we're good to go. We monitor, we move on. Okay. So the key here is center, left, right. But they are going to be similar. So you got to be really careful what's your priority. So in general, we talk about what will keep your patient most safe. What are these general umbrella terms? Okay. So if I say, so there was a question that my RNs had the other day, and they said, well, how do I know? It was a 74-year-old lady, and I don't remember what the question stem was, but the options were practice safe sex, use lubricant to prevent tears, and I don't remember what the other two were. And they were like, well, she's 74. We want to prevent tears. And I said, well, yeah, you do. But if you practice safe sex, that includes lubricant and preventing tears, right? Because if you have a tear, you have broken that first line of defense. The skin is broken, risk for infection. That is not safe sex. What is safe sex? We want to prevent infection, right? Among other things. But so if you choose safe sex, it's going to include the rest of that. Okay. So it's these umbrella terms. If I say I'm going to meet my client's physical needs, here are your options. Option A, I'm going to meet my client's physical needs. Option B, I'm going to meet my client's physical and emotional needs. And I'm simplifying this, but just so you get the idea. Option C, I'm going to meet all of my clients' needs without judgment. Option C is your answer, right? Because you have met physical and emotional, and you've done it without judgment. So that's your umbrella term, which allows for you to choose all of those ones that are underneath it. And that's where you guys get hung up because you're like, well, those are all right. I'm going to meet my clients' emotional needs. I'm going to meet their physical needs. Yeah, you are, but you're also going to do those without judgment. So choose that one that encompasses everything else. Okay. Jeffrey, does that help?
Yes. Yeah.
Okay. So when you're trying to go for that most correct one is what is going to keep my patient the most safe? And in that prep one, it talks about if I can do only one thing for my patient. And when you come to me next term, on day one, we talk about this Kaplan decision tree, and we're going to talk about this NCLEX RN and PN book. And what is the one thing? If you are in the ED and you have 7 patients, and I'm like, nope, sorry about your luck, there's a trauma. I'm giving you patient number 8, and you can only do one thing in that room to prevent yourself from going back in 5 minutes later, what's it going to be? Put some oxygen on your damn patient, right? Because if you just go in and you say, here's the incentive spirometer, or you raise the head of the bed up, you're going back in there 5 minutes later because if those interventions didn't work, Now you got to go in there and you got to put oxygen on your patient anyway, right? So if
Mm-hmm.
there's one thing that you can do to prevent your patient from dying, your patient that's having a heart attack, what are we going to do, right? Well, we're going to give an EKG or we're going to give some kind of med, whatever it is. What is your priority in that moment? That will help with the approach, okay? And then, it just takes practice. So it's a matter of, you're not going to like it, but practice those select all and apply questions. They're at nurseslabs.com. Um, nurseslabs.com will give you practice questions, and you can literally go in there and choose a practice exam that is 50 select all that apply questions, every last one of them. It doesn't feel good, but it'll make you better at it, okay? One second. Professor Sex is going to go down and get our food. I got to text her. Priorities, guys.
Right. Gotta eat.
Our food is here. Downstairs, east entrance. Okay. So it's just a matter of doing that practice, okay? And just getting used to it. It's tough. It comes with time. Okay. So I want to move on to specific HESI remediation then. I have so many tabs up that I have to figure out where I'm at here. Okay. Um, I'm gonna pull up. I don't want to show. Let's see. I'll go into this one. Let's do. This is what I used today. Okay. All right. I'm gonna share my screen again. Um, I gotta figure out which one it is. Okay. So when we talk about HESI remediation, Um, yours is going to look a little bit different from mine. In yours, your essential packets are going to come first, okay? Mine is just set up a little bit different. So when you're in your remediation, you're going to have all of these essential packets up here, and then you're going to have the case studies and the clinical judgment skills, okay? So in essential packets, what you need to do, make sure you click on this whole thing, okay? Because what this is going to do, I think yours is like a caret or a plus sign. This is going to open a bunch of stuff for you. You have to do all of these, guys, okay? So what used to happen, and Megan is one of my students, she was an RN student, and she has given me permission to share her story, is she said, she goes through capstone, gets like an 887 or something on the exit HESI. Second attempt gets an 880 something else. So now she's coming back to capstone the second time, which is when I had her for sim. Same thing, two more exits. So finally, on the third go round, I said, Megs, like, what are we doing different? Because you have an 86% KGA in capstone or whatever it was. I don't know. It was high. I'm not going to give her grade away, but it was something high. But is struggling with these exits, right? And she said, well, tell your students, she said, you have my permission, tell your students to take the HESI remediation seriously, because what she was doing is she's going in here. And so you can see the estimated time, right? Estimated time, 12 minutes, time spent, 17 minutes. I'm okay with that. If you're reading this a little bit slower, estimated time, 15, you only spent 12. The problem is when we only did the time, then somebody clicks on this and then they go and they play with Tucker or they take a nap, right? And this, when you're clicked in it, it just runs and it runs and it runs and it runs. And so if you only need an hour or you need 2 hours, this just runs for 2 hours, but you don't actually get anything out of it, okay? So she's kind of the reason we're like, all right, cool, you're going to do all the essential packets then. So, but learn from her mistakes, she said. So She went back. You can see every single HESI you've ever taken. It sticks with you throughout the program, however many it is, every HESI you've ever taken. So what I want you guys to do is when you go into these, you can, I'm old, but right click and you can either save it as a PDF or print as a PDF or save as a PDF from here. So what I would do is I would save it as a PDF and then I would go and print it because I need the hard copies. So one of my LPN students did that and she has this giant binder of stuff. And I said, "What is that?" And she said, "It's all of my essential packets." So you'll scroll through. It's not a whole lot of reading, but she's gone through and so she prints this. And so she says, "This is going to be basically my study guide for the exit HESI." Okay. So what we've done, yeah, it's brilliant. So what we've done here then is these are all of your opportunities. Okay, so for this student, there's a shingles, there's another shingles, transmission-based precautions. Okay, so for the student that taught me this, now she sits down and she's got this nice little binder of all of these things that at one point were her opportunities that are now going to be her strengths because she's got it in one place. So I told Megan, I said, "This is what I want you to do. Bear with me. Let's do this." I said, "But you got to go in and you got to remediate every one of those HESIs, like for real. You got to remediate them all." Because throughout the program, she goes in and she lets this time run. She doesn't actually get the remediation, right? She said, "Well, but I got 1,000 on my foundations HESI, so I just went in and let it run for an hour. I didn't think I needed remediation." And now we're here, right? Now she's a staff sergeant and she's just like killing life. But so now we're here. So I told her to do that. So she's like, "Okay." She said, "Tell your students, like, here I am. I'm kicking my own ass so hard because not only am I trying to get through capstone, but I'm trying to remediate every single HESI I've ever taken. So I'm remediating like a HESI a week because I've taken 12 HESIs. Plus I'm remediating these exits when if I would have done it as I went, right? So you guys, who all's on here? Most of you are foundations, Jerry. Yeah. So you guys then go in and you remediate that foundations, HESI, you remediate that Jerry now, right? Remediating the second HESI is not required, but it is highly recommended. And I will tell you, when you come to my class, I will check. I will check to see if you are remediating that second HESI, and you will get a text message or an email from me, because it will only help you, okay? You have to remediate the first one. So what happens is, for this student, if this is you, you go in and you remediate these, and herpes zoster is shingles, okay? So you've remediated shingles, you've remediated this transmission-based precautions. Hold on, guys. I texted you. Hold on, priorities again. Um, I don't know. It says they're like 1 minute away. Sometimes they go to the west entrance. Okay. All right. All right. Back to business. Sorry. So these are the opportunities, right? So then what you do is you remediate these. So the idea is when you take that second attempt, none of this shows up on that second attempt, right? You are going to have new opportunities. You are going to have new essential packets that I'm going to want you to go in and remediate because you have new opportunities that can now become strength before you go into that exit. So throughout the program, what happens is if you pass the class, I don't do this, but if you pass the class and you only need a 40 on the HESI and you get a 40, you still pass the class, right? However, when you get to capstone, guys, you can have a 92% overall on your KGAs. If you don't get a 900 on that exit HESI, you're doing that class again, okay? The 900 is the benchmark. So it is so important that you go in and you actually do these remediations, okay? So that's the first thing. So read through these, print these out, okay? So you're going to go through and do these. If you do the clinical judgment skills, okay, this is going to walk you through that whole nursing process here, okay? So this is going to put you in that clinical setting. Your essential packets are, paragraphs from the chapters or a specific chapter from the book, and there's your theory. When I was in school 100 years ago, it was theory and clinical, right? So your lecture is your theory, essentially. Here's your clinical setting. So then you're going to go through and you're going to read through these. These are really, really quick. I can't click on them because this student hasn't accessed them yet, but these are really, really quick. And then you do these, and then you go back up and you do these case studies, okay? So what happens is students will say, I'm just going to do the case studies because that's what's required. And it takes them like 4 freaking hours to do the case studies because they haven't done any of the pre-work stuff. Okay. So thank you. So go Okay. So go in and do the pre-work first and then go in and do the case studies. And these are going to unfold. And sometimes this will give you bow ties too. So thank you. So you might get some bow tie practice, okay? So essential packets first, clinical judgment skills, and then end with the case studies, okay? And so the idea is by the time you finish this, then these are now opportunities, okay? So back to my student, I said, all right, Megs, this is what you're going to do. You're going to go in. Obviously, you've done the case studies. You can always go in and re-access them again. But I want you to go into the essential packets. I want you to read through these. I want you to spend time. So that term, I'm teaching med surg, and my students all of a sudden just have this look on their face. And I look up because I don't know what's going on. And here comes this student running into my classroom in tears. And so on the first attempt of the exit HESI, this next time she got like 1,000 and she was sobbing and she said, I wish I would have done it right the first time. Tell your students to take my advice and do the remediation the right way, okay? I don't believe in busy work. Anybody, none of you have had me yet. Lucky you. Okay. I'm gonna stop sharing my screen for a minute. But when you get to me, oh nope, Doreen's on here. Doreen has had me. Sorry about your luck, baby. So when you get to me and we do NCLEX questions, I don't require you to remediate. I also don't require you to get a 78% because I want you to go in there and I want you to, in your mind, fail miserably. So if you go in and you do your NCLEX questions and you get like a 42%, you still get credit as long as you did the topics that I assigned you. So I have realigned everything, my lecture, my lab, my sim, my NCLEX questions, all of that goes together. The idea is your NCLEX questions are not part of your KGA and they're only 6% of your grade. So you go and you do the NCLEX questions. If you get a 40% on ABGs, you study ABGs. So then when you go to take my exam, that's like 20% of your grade, you don't get a 42%. Okay. Let's be real. I was a student too. When you have to get a certain score on the NCLEX questions, you go in and you Google the answers because you don't want to do the remediation. I get it. I
Hmm.
get it, right? I know, girl. There's no judgment. But the thing is, put the work in at the beginning, okay? So, I taught at another place and we did ATI and they would go in, they would Google all this stuff. And so they'd have this practice predictor or whatever, and they'd get like a 96%. And they're like, woohoo, no remediation. And I go, yeah, well, and then you just got a 60 on the actual exam and you get to take my class again, right? Put in the work up front. And that's why I don't require that. When I made that change, my exam averages shot up like almost 10%. And I've had
Wow.
students say this is the first time I've ever actually done the NCLEX questions. Their practice, again, I don't believe in busy work. Do them. I don't care if you get a 40%. Now you know where your opportunities are. This HESI remediation works the same way. Go in and actually do the remediation, guys. And then the second time around, then you get an even better score, okay? That's how it should work. If you spend the time up front, then you don't have to repeat capstone 3 times. You don't have to repeat these other classes. And you don't have to, in Megan's words, kick your own ass as you're going through trying to remediate. Instead of remediating 3 HESIs this term, you got to remediate 12 HESIs. And the exit HESI starts in week 9. So now you get to remediate 12 HESIs. So all of your year and a half or 2 years, whatever program you're in, you get to remediate that in 8 weeks and try to pass. You throw that Hail Mary, right? I'm not really a sports person. I do basketball. So do it now, spend the time now, even if it's painful, because it ends up paying off in the end. Okay. So I want to pause because I just threw so much stuff down your throat. But essential packets, your clinical judgment skills, then those case studies, and spend the time, print them out. You have it. Okay. So I am going to tell you with a word of warning, please don't do this to your instructors. Okay. Obviously the better you do on the HESI, the less remediation you have. Okay. Don't go in and do poorly. You have that second attempt. You guys have this second attempt going on. If you got over 900 on the first attempt, which I think all of you did, Don't go in and get a 30% on the second attempt. Take it seriously, okay? It's practice. First of all, if you do that, you make us cry because we feel like we failed as educators because now nobody can get over like a 300 on my HESI, and it's just because you guys are doing it on purpose or you're not taking it seriously, right? Take it seriously. Go in. If you get a higher score, we take the higher of the two. So if you got a 96 on the first one and you get a 98 on the second one, we're going to put that 98 in. It is still practice, okay? So take this one seriously, combine the remediation of the two. The idea is if you have a bunch of remediation on this first one and you spend the time over the next 2 weeks and you just crush the second one, you don't have very much remediation. And then you can go in and you can spend a little bit of time on that remediation. I really do encourage you guys to do the remediation on the second attempt. After this term, yep, for most of you, there is no second attempt. Okay, so foundations, farm, you get 2 attempts. Med surge, one and done. Maternity, one and done. Community, one and done. All the way throughout until you get to capstone. And then it's high stakes, and you do have 2 attempts on that exit. Okay, shoot for the first one, but you have 2 attempts on that exit. Okay. So I only have one other thing that I want to show you, which is that readiness thing, but I feel like you probably need some time to digest. So questions, comments, clarifications, what do I need to go back over? I know I'm a fast talker. I'm going to be quiet for a second and let you digest, and then I'm going to pull up the last thing that I want to show you and share my screen. But let's kind of address some things before we move on. What, and if you don't want to say it in the out loud or in the chat, that's okay. You can do a private chat, and I won't tell anyone who it's from, but I'll still address the question. While you're thinking about it, I'm going to write names down too, because I want to make sure everybody gets credit for being here, because I had some more people jump on. Was it? Oh, yeah, there it is. G. Okay. Okay. Let me pull up the last thing then and reshare my screen, and then we will open it up for last bit of questions. What I'm going to show you is going to look just a little bit different though, because it's going to be a group of students. Okay. So let me share this again. So what I'm going to show you is NCLEX. I have to look at it again. Hold on. Readiness for NCLEX. That's what it is. HESI readiness for NCLEX. It is a HESI readiness for NCLEX dashboard. Okay. So what that is going to show you, that's what I was briefly mentioning earlier, was you can go in and you almost have like this predictor on your exit, okay? So this is going to be a whole group of students here, okay? When you look at yours, it's going to be just yours. So it is going to combine all of the HESIs that you've ever taken, okay? So, for instance, this group of students has taken about 10, okay? Based on HESI results, this is the likely score on the exit. And like I said, a student just showed me this last week, and I think it's amazing. And every person that I've looked at and taught this to since, they've been well above this. The student that showed me, I think her predicted was like 878, and I think she got a 1200. I mean, it was outrageous, but she also did the remediation. So, and then here's the likelihood of passing the NCLEX, right? And you guys know 100% LPN pass rate on the NCLEX for like 2 years running, just about. Killing it. You guys are killing it. And the RN board pass rates are very good too. So what you will do then is you will go into your own personal stuff. You go into remediation and then this HESI readiness for NCLEX, and you're going to look. And what it's going to do is it's going to put all of your specialty exams together. So for some of you, that's going to be 3, right? Farm, foundations, Jerry. For some of you, it might just be foundations and farm. It just depends. So it's going to put all of these together, and it's going to give you your likely HESI exit score based on where you're at right now. You can click into these things and it's going to tell you what your opportunities are. So if you go in here, here is your personalized remediation for the exit itself, okay? So you have that personalized remediation for whatever it is, foundations, HESI, whatever HESI. For this is your individualized remediation specific for that dreaded exit. I wish I would have known about this a year ago. It is brilliant. And so then you go into this remediation specifically. And so you have taken your first attempt on foundations, you've remediated, you've taken your second attempt, you've moved on to all of these. Now you're going to remediate all of those HESIs all in one because it's your opportunities as a whole. And that's what gets you ready for the exit. And that's what that student did. And she got like a 1200, and it didn't even take her that long to do it. I think it's so smart. And like I said, I wish I would have known about this. So once you get a little bit deeper into the program, you're going to want to start going into this and monitoring this. And this likely exit score will change. And you'll see the evidence will be there. The more you remediate, the higher this is going to go up because the better you're going to do on those subsequent HESIs, guys. I promise it works. I had a foundation student last term score 734, somewhere in the low 700s, and in 2 weeks went in, did the remediation as intended, did practice NCLEX questions as intended, and got a, the highest you can get for me is a 1250. He got a 1240. 734 to a 1240 in 2 weeks. I mean, it was outrageous. And I said, what did you do? And he said, I did the remediation like you said. I'm going to stop sharing my screen. I did the remediation like you said, and I did some additional practice questions. Okay. So that can definitely be done. But you got to take it seriously. Okay. Don't treat it as busy work. You guys have enough stuff to do and enough busy work. It's I promise this works. Okay. And so then what happens is, as this series, this is my closing remark, is you do the HESI prep, you do this HESI remediation in week 2, 3, we're going to put it all together and say, okay, you prepped, you took it down, you remediated, you did even better. Now what? Because now you have a new HESI to prepare for, right? And so we'll continue this series, but it'll be a little bit different and you guys kind of lead it. And we'll talk about how do I better break down those questions, right? Cover up your answer options and read the question. If you can answer the question without looking at the answers, do not change your answer, okay? It means that you know it. Go with your gut. If you don't need the options to answer the question, it's because you know it, guys. You guys are that smart, okay? I had a student tell me, and she also said I could share. She said, when I approach these questions and it says, the nurse walks into a room and the blood pressure is 80 over 60, what does the nurse do? And she said, I don't care what the nurse does. I care what Laura does because Laura's the nurse. And so when you go in and you assess your patient and your blood pressure, whatever I said is 80 over 40, what's Laura going to do about it? Laura just killed the exit HESI. And that was her approach. And I shouldn't tell you this because it's being recorded, but she said, I didn't really study that much, Hein. I just said, what's Laura going to do about it? I said, well, that's great. And she killed it. Like, I mean, just crushed it. So think about it, right? And I tell you guys that all the time. Any of you that work in healthcare, I say, well, what are you going to do? Well, I'm going to tell the nurse. No, baby, you are the nurse. You are the nurse. There's no telling anybody shit. You got to fix it. Okay. You're the nurse. So I will remind you guys of that. You are the nurse. If it says, what is the nurse going to do to fix it? What are you going to do, right? At the end of the day, this program says you have a license to be able to take action. And I'm going to say, yep, they're good. The dean's going to say, yeah, they can do it. The NCLEX is going to say, yeah, let's put those letters behind their name because you know how to fix it. But you got to put the work in the meantime, okay? And all of you can do it, and you want to because you're here. So, all right, I'm gonna stop talking because I know you're tired of listening to me. What questions do you guys have? What else do I need to address? If you don't have anything, you can go ahead and jump off, or you can hang out and listen to whatever, other people bring up. As soon as this recording converts, I'll get it posted on the YouTube channel. But what do I need to address further before we jump off here? Anything? Everybody wants to see Jeffrey's cat again. I am gonna stop the recording though because we're gonna put your cat on TV without consent. Oh my God, I love him so much.